The use of chemicals is very synonymous with our daily lives. Therefore, we need to handle those chemicals in the right way. First, we need to know the chemical route of entry so that we can handle chemicals safely. Chemicals can enter our body through the respiratory system. Inhalation of chemicals occurs by absorption of chemicals via the respiratory tract. Once chemicals have entered the respiratory tract, the chemicals can then be absorbed into the bloodstream for distribution throughout the body. Chemicals can be inhaled in the form of vapors, fumes, mists, aerosols, and fine dust. Symptoms of exposure to chemicals through inhalation include eye, nose, and throat irritation, coughing, difficulty in breathing, headache, dizziness, confusion, and collapse. Chemicals can be absorbed by the eyes and skin, resulting in chemical exposure. Most situations of this type of exposure result from a chemical spill or splash to unprotected eyes or skin. Once absorbed by these organs, the chemical can quickly find its way into the bloodstream and cause further damage, in addition to the immediate effects that can occur to the eyes and the skin. Chemical exposure through ingestion occurs by absorption of chemicals through the digestive tract. Ingestion of chemicals can occur directly and indirectly. Direct ingestion can occur by accidentally eating or drinking a chemical. A higher probability of receiving chemical exposure can occur by way of indirect ingestion. This can occur when food or drink is brought into a chemical laboratory. The food or drink can then absorb chemical contaminants, vapors or dust, in the air and result in chemical exposure when the food or drink is consumed. Ingestion can occur when a chemical handler does not wear gloves or practice good personal hygiene, such as frequent hand washing, and then leaves the workplace to eat, drink, or smoke. Chemical exposure via injection can occur when handling chemically contaminated items such as broken glass, plastic, pipettes, needles, razor blades, or other items capable of causing punctures, cuts, or abrasions to the skin. When this occurs, chemicals can be injected directly into the bloodstream and cause damage to tissue and organs. Due to direct injection into the bloodstream, symptoms from chemical exposure may occur immediately. So, we are required to handle the chemical properly. Below is 8 methods that can be practiced during chemical handling. Firstly, make sure you know the identity of the chemical you are using. Understand the nature of the chemical and read the safety data sheet, SDS, carefully. Use the correct container to store the chemicals. Label your container properly according to regulations. Arrange the containers neatly and correctly in the designated area. Do not store incompatible materials close to each other, separate them. Avoid direct contact with chemicals. Lastly, use appropriate personal protective equipment when handling chemicals. Thank you for watching the video. Remember, handle the chemical wisely and be safe.